Hello, everyone. Welcome to our session on um, COSECSA info session. We're just here to give you a general idea of what to expect during the COSECSA exam. And I have here multiple guests for you. We're going to start off with Dr. Rahel, who's a plastic and reconstructive surgeon at working in Ethiopia. She has taken the COSECSA exam, so she will let us know which year she took the exam for and the general preparation that she had to go through. So, Dr. Rahel, welcome.
Thank you for having me. So, thank you for the introduction. My name is Rahel Kasa. I'm a plastic and reconstructive surgeon working in St. Paulo's Hospital. I took, I sat for the COSECSA FCS exam in 2023 here in Addis. And so I'm just here to give you like a heads up on what to expect during the exam, on what things to focus on, how to prepare for the exam, and so on. So if you have any questions, I would also be happy to answer what you want me to answer.
Yeah,
So shall I just give you a brief introduction of what to expect?
yes, please.
So during the COSECSA exam, uh, in the morning there's a debriefing on what your exam would look like, and then you'd have to go. You'll be taken somewhere, and there will be 7 or 8 stations. And in one station, there might be two patients or one patient, or a patient, and you'll have a picture to comment on. So, and there will be two examiners per station, and so examiner will ask you, and the other examiner will ask you only few questions, while the other one hears your response. And so the things that you are expected to know is usually like, is that person very confident about the case, the way you respond, the flow, and is it like a very systematic way that you're responding. And and then initially you have to introduce yourself before touching the patient, and and to thank the patient afterwards as well. And so you have to tell the patient what you're going to do when you are asked to examine. And so these things really matter in the assessment of your exam. So things to prepare on is usually for the plastic and reconstructive, um, Grab and Smith is a good book to revise. And then you have to practice the way you would be presenting. Um, your voice needs to be loud, and then you have to record your voice and listen to your what your voice looks like beforehand, so that you can correct that as well. And your flow, you have to practice that, and it really makes a difference. So I think that's it.
Yeah, that's great. So it's very important. You mentioned confidence is very important because the first impression is everything, right? And when you walk into the room, that's really the first thing that the teachers are seeing. Also, you have to dress properly. We can't undermine stuff like that, right? You have to get your hair properly put together. You have to have your gown put together and your clothes put together. you can, I think as females you can wear pants or dress whichever you want, but it has to be a decent length. Wear comfortable shoes, because you'll be standing, and also the exams are given in the wards, so the ward floor may be slippery. It's a different, you don't know what kind of situation there is, so it's always better to wear comfortable clothes. um, Okay, Simba is here. I'm trying to let him in. Simba, can you hear us? Simba, can you hear us? Okay, I don't think he can hear us. Okay, so so those things should be kept in mind. Be as comfortable as you can. You're right. And also, um, eat before you go for the exam, because you don't want low blood sugar. I know this sounds kind of like cliche and don't need to be said, but so many of us, we become very anxious during exams, and you might not eat or something, but there is um there is sequence how you're gonna go into the exam. So you might be the fourth person or the fifth person for your station. So you don't know how long it's gonna take. What I suggest is just eat something, or have a bar or something in your pocket, like a protein bar. Get yourself a bottle of water or something, and hydrate yourself. And yes, be well fed when you do get there. Um, and also you said there are different stations, right? So typically, what kind of cases have you seen yourself on the exams at the stations?
Okay. So what I remember is like there were so many soft tissue defects that you'll be asked on the reconstructive options of the defects. You have to take the physical examination. On physical examination, the what you see and the possible cause for that problem, and then what are the options of reconstruction. So usually, because we don't like, what we do is usually local flaps. We don't do free flaps nowadays. They're being done, but we usually do like the local options for defect reconstruction. So on our exams, what we used to say is free flap as an option, but we have to know what type of free flaps that we need to do for those patients. What are the recipient vessels, the donor vessels? So, what are the options? So, we need to know the details of that as well. And aesthetic is not commonly done in our hospitals. So, we don't have the exposure, but that doesn't mean that we're not expected to know that as well. So on aesthetic breast reconstruction, but it's not breast reconstruction only, but like breast lifts, augmentation, all those like tummy tuck, abdominal contouring procedures, nasal reconstruction, and also rhinoplasty for aesthetic. Uh, and so aesthetic needs to be well noted for when we study as well. And the other thing that I want to say is just to stay calm. Sometimes, few of the cases you may not know but you have to be calm and like try to find a way of responding so that you can get away with like something rather than um, just panicking and then I mean uh, it will affect on the subsequent stations. You'll be disturbed and it will be difficult for you. That's what the other thing I wanted to mention.
Yeah, I completely agree. Interesting. So what do you suggest if examinees didn't have that much of an exposure when it comes to especially aesthetic surgeries or cosmetic surgeries? How it's last minute, exams are around the corner. What would be the material or the resource they can use to familiarize themselves to such procedures? Because you don't know which station you're getting, right? So you always have to at least have some sort of general idea about the cases, because you don't want to go in there and just stand and don't say nothing. Like that's the worst thing you could do. So at least you need to say a few things. So where can they get that idea from? What resources can they use?
Uh, so so you have that on Grab and Smith and everything, but because of the time limitation, you may need to look on YouTube so that you can have the general ideas of the procedures. And so, and then there are cases that usually comes on the exams like liposuctions. What do you do? Abdominal contour procedures. What do you do? And so those common cases you have to be aware and try to read on those topics as well.
Yeah, that's so good. Okay. So um what would be in specifically for plastic and reconstructive surgery, what would be the main things on history that you need to ask, on physical examination that you ought to see, like without those steps? Because we already know how the examiner is going to be grading us, right? So they're given certain criterias, and those criteria are not about the most advanced science or theory you can discuss. They're more of what is the basic practical thing that the person is able to assess, right? So, what are those things in history and on physical examination that are must to check?
So that's depending on the like the diagnosis. Like sometimes it can be a congenital deformity that you're saying. On the other hand, it can be a traumatic condition that you're seeing. On those occasions, the history also is different. Like if you have a hand patient with trauma, you'd be so in any trauma cases, you have to start with the ATLS, um, whether it's burn or any simple traumas. So ATLS is important, the vital sign is important, and then like the mechanism of the injury, and if there was any comorbid illnesses. So the sociodemography is important. So in a systemic way, we have to go, and the occupation of the patient, and then if was right-handed, left-handed, and then like the duration of the trauma, what was done initially after the trauma, how was that patient managed, where was he managed, and then and then the fingers involved, the amount of tissue destructions that has happened, the disability the patient is facing, what his chief complaint is. All those are important. Physical examination again, the general status, the vital signs, and then seeing the general condition of the patient, and then going specifically to the trauma side. And then when we are asked, we don't need like to be guided by the examiner. We have to just immediately say like, imagine ourselves that we are the consultants and we're trying to teach others, or we're talking to a colleague. We have to assume that, and so we so try to be like holistic on answering, and then just continue with the physical examination, and then the surgical. If there's a conservative management, say there's conservative management, how we follow conservatively. On surgical management, the surgical management options. Postoperatively, how we manage that, and then possible complications associated with our management, and if not managing well, all that matters. So those things needs to be noted.
Yeah, thank you. I think you raised an important point. As much as possible, you have to avoid the examiner taking the lead. Um, Whatever comes to your mind, you have to say it. Of course, don't blurt out something that makes no sense. Just don't say random stuff, not to be quiet. But you should take over the flow of the exam. And yeah, we'll come back to other points that I am gonna ask you. Um, Before we go into the Viva part, I wanted to finish off the OSCE part. So Simba is here. Hi, Dr. Simba. I think you're muted. You're muted on your side.
All right, there you go. How are you?
Oh, good. What's up, brother?
Oh, good. What's up, brother? I'm all right. I'm all right. Thank you for having me.
Yeah, great having you
Yeah, great
as
having
usual.
you as usual.
So, are you in
So,
theater?
are you in theater? Yeah, I just finished my last case. I had quite a busy day, so I'm trying to write some notes while I'm attending the meeting. So don't mind me typing, but I'm here. I'm present.
No, please go ahead.
No, please go ahead. All right.
So we
So,
are talking about just the general flow of the exam, right? What students must expect, examiners must expect. And Dr. Rahel, she's a plastic reconstructive surgeon in Ethiopia, and she touched on some things particularly for her specialty. So can you walk us through? We're talking about the OSCE part. So, can you walk us through the most important things that you think examiners must do? Nothing is trivial, nothing is too small, whatever comes to your mind based on your experience, whatever you think is valuable, go ahead and share with us.
share with us. Yeah, I think I was listening to your conversation with the plastic surgeon. I don't think I can pronounce your name properly, but yeah, I must say, look, going into this exam is not easy. I think you just have to know that, even if you have, I think the idea of an exam, clarifying, right? And I don't know what tricks you need to use, maybe deep breaths, or I don't know, listen to some calm music before you go in, because I know you can be scared. I know I was scared a lot. And I think because of that, I really had a bad first station and second station. By the second station, I think I had a good examiner who tried to calm me down, because when you're scared and you've got this adrenaline rush, you will forget even the simplest things. Yeah. So I think the first thing is try to calm down. And it's I think what we always say is, this is an exam for a day one specialist. So it's not about you being at a level of a professor, or been working for years. I've been an examiner for the past 4 years, and we always have to go through this. You need to know that you are expecting questions for a day one specialist. Yeah. So I think most importantly is, you just have to remember, if you've reached this far, you definitely know the answers. Yeah, that I can tell you. And like you say, nothing is trivial. So a systematic approach is good. Second thing is, listen to the questions being asked. Okay, so sometimes, when you don't listen to the question, you start going off tangent, and the examiners will try to bring you back. And like you said, you have a situation where the examiner starts talking, and that's a bad thing. They shouldn't talk. They should be listening, and you try to answer systematically and answer the question that you've been asked. The reason is that there's probably like 7 to 13 questions that you're asked, and you've got about 13 minutes to answer. So you need to answer systematically in order so that you get asked all the questions that are on that station. Yeah. So try to calm down and try to listen to the questions that you're being asked. And I think over the years we have cleaned up our act as examiners. Examiners are coming in a little bit more friendly, more calm. Of course, they will not accept wrong answers, but we are allowed to sort of bring you back when we see you're going elsewhere. Okay. Yeah. And just trying to get you on the right track. So I think those are the two most important things that I would share before you go to the Bible.
Yeah, I agree. Great points. Also, like you said, get enough sleep. It's just so many basic things that we don't talk about, but that are extremely crucial for our exams. Our exam day, like we said, eating, being hydrated, and also sleeping. Just sleep. There is really not much you can change overnight for before right before your exam. Yes, short-term memory is the best, but also you need to be like Simba said, calm during your exam. So rest is very important for that. And like you both mentioned this, but you need to be lead the exam, because the other thing that can happen, and I don't know if either one of you have seen this before, but when you go into when people try to show off, right, whatever they rate, which is obviously something we would love to do to show how much we're prepared, but we go into this rabbit hole, and the examiners love it, and they start asking you questions that you probably might not know the answer to, because they know better than you. They're more experienced than you, right? So you're gonna get yourself in this cornered, and you don't even know how to get out of it. So as much as possible, stick to the basics of things unless the examiner specifically asks you. And also on the OSCE, if the examiner is asking you something more advanced, it means you're doing really good, as long as you're not the one who put yourself in that spot, right? So if the flow goes really well, and you're answering all the basic questions, and they're like, okay, so what more can we get out of this person, and they start asking you more difficult questions, that means you're doing really good. So calm down always. The other thing is, you always have to be respectful to patients. Don't forget that. I cannot emphasize that more. Whether that's for your exam or in your daily practice, you always have to be very respectful towards patients. Okay, they're in a very, very, very vulnerable state when they come to you, and as a physician, our number one job is to comfort them, and because it's through that comfort that they're gonna talk to you. And give you all the information that you request from them. And mind you, sometimes when the COSECSA exams, they're in different parts of Africa. So sometimes those people never seen someone like you. They're not familiar to you. They're not familiar to the language you speak. So that's an extra additional layer to consider. So you have to be extra careful. Make your patients comfortable. If they have interpreters, also make the interpreters comfortable. So when you walk in, introduce yourself to your examiners, and introduce yourself to your patient, where you're from, what you're there to do, those basic things. But when nerves kick in, we tend to forget those things, but those things are extremely valuable, because if the patient doesn't feel like this individual cares about me and sees me as a tell you what you ask them to. Clear questions, have clear questions. Like I said, sometimes you might need an interpreter. Sometimes, the way you pronounce things are different from the way they pronounce things, even if they're English speaking. So you have to keep all these things in mind. Be calm, use a calm voice, have short and clear questions, which brings us back to practicing the kind of questions you need to ask. So Simba, I asked this to Dr. Rahel, that's her name. Um, what are, because I know in ortho we have these questions that the boxes we need to take as questions on almost every patient, whether it's trauma, whether it's congenital. Yeah, when we go in depth, the questions might be different, but there are some basic questions we need to ask and basic evaluations we need to do on physical examination. So can you walk us through those things in?
Yeah, I think I forgot to mention something, right? If you reach this far in COSECSA, then you understand that there's about 14 countries going into 15 countries, different languages, and different geopolitical environments. So this year's exam is in Burundi, right? So I think you need to prepare for a lot of trauma, and not just trauma, but a lot of neglected trauma. You also need to get ready because Burundi has been a war-torn country for a while. You also have to know a lot about ballistic injuries. So also when it comes to plastics and reconstruction, I think there's going to be a lot of that. How would you reconstruct this? You're going to have facial injuries, all kinds of neck injuries, contractures. These overlap with orthopedics. So you have to learn contractures. You have to learn trauma, neglected trauma. You have to learn ballistic injuries, bullet wounds, shrapnel wounds. The reason I say this is 2 years ago, I was an examiner in Ethiopia, Addis Ababa, and most of the students did not do their homework about Ethiopia. And there were like 3 stations on leprosy, right? And this is leprosy in orthopedics. So you find that the students who were from Ethiopia and those who had sort of done their homework, they just breezed through because they were like, this is leprosy. But then you see when you are a little bit south of COSECSA, they really struggled with those stations. So I think expect that station. Expect a station in ortho for polytrauma because of the same, right? Batic injuries, etc. Right? And then, of course, common things are common. There will be tumors, there will be infections. Um, I think if you sit down and make a list of what they call high yield topics, I guarantee you those are going to be there, right? So make no mistake, that's going to come, right? That's why I say that the exam is designed for a first day specialist to know what to do, right? And it's also designed in such a way that the good students pass. All right. The bad students are going to fail. If you're not ready for this exam, I'm telling you, you're going to fail. Right. And then when it comes to, I think you mentioned that, that when you reach that OSCE level, it means that you've done it. Right. And you can tell even from the mood of the examiners that, look, I think I'm in the zone now. Right. And, you can basically just freestyle. Yeah. So I think in conclusion, I'm saying do some homework on Burundi. From what I gathered, those are the topics I think you need to look at, and also common things are common. Look at high yield topics and make sure that at least you get the basics of management of those conditions. Yeah.
Thank you so much. That was good. Yeah, that local context is very, very important to look at, and not so many of us actually do that. I remember when I went for my exam, it was in where was it? I think it was in Zimbabwe, and I did none of that. I mean, thank God I didn't have any questions that were completely, something we've never seen in Ethiopia or anything. It was just pretty much the standard. But yes, you're right. There's also that to consider. Um, also, okay, as an examiner, because you've been a previous examiner, what are the basic things? For example, family history, right? Um, Comorbid conditions. This the basic things you're supposed to ask, but you don't ask. Um, it may be very specific to the case, but there are some general things, right? So mechanism of injury for trauma that you both mentioned, and is it acute? Is it chronic? Is it acute on chronic? There are different, right? Subacute. There are different. The time duration is very important. Those are the things you need to ask. The location. The kind of pain, those things that are that seem so simple and that we naturally do them in our work environment, but when we're in the exam, we think it might be trivial to ask. So as an examiner, what do you see, what do you like to see examiners do when it comes to history taking? Let's narrow it down to history taking, and then we'll come to physical examinations.
Yeah. So the style of exam right now where we've reached, you see that we normally would give you, quite a comprehensive history. If you don't have a patient who's going to give you the history, right? We normally give you like all the information, and then we kind of look for what other extra questions do you want to ask. So I'll give you an example. Let us say we've given you a case, and maybe this patient is having knee pain and he's been there for a while. And then we're saying, oh, they've tried everything, but they don't know what's happening or what's going to be your next question, right? So I think in a situation like that, that's where you need to know how to take your pain history, right? So how do you break it down? The mnemonics for this, Socrates, what's the site, what's the onset, and things like that. I mean, you kind of go back to the basics because you want to understand what are we looking at. And then maybe someone can hint that, oh yeah, someone did an X-ray and it kind of looks like this, and then maybe it looks like there's a tumor or something like that. Then you know that you're going to design your questions, your answers, sorry, or your history towards understanding everything else around it. Why? Because bone infections and tumors kind of look the same on X-ray. So when it comes to history taking, yeah, the style is if you go in expecting to have
Okay, I think Simba is breaking up. Oh, well, network.
I think listening to the question is important, and taking history, like you said, you need to still be systematic and try to get just the specific questions out of the way. And sometimes patients actually give you the answer. Like if you're listening, they can see that, oh, maybe two other people who came through didn't ask this question. They will kind of nudge you or try to show you, because most of these patients are, they want to help. Yeah. So I think just be on the lookout for that. But obviously, history taking is important before you go to physical examination. Yeah.
That's great. I
That's
think in
great.
order, the
I
other
think
thing
in also the other
we need to be mindful is not asking enough questions on the history and not doing enough physical examination and just depending on the X-ray. The examiners can tell, okay, because these are experienced surgeons. So they can tell if you're just making your assumption based on simply the X-ray versus from the information you gathered. So be careful. You cannot, don't think you can outsmart these people. Be systematic when you prepare, like this last few days when you prepare. stop trying to cram too much of like science per se. Be more study more clinical oriented kind of studying style, and build that system in your head. Do it again and again and again, and practice with your friends. I really think that's very important. When one of you acts like an examiner and the other can talk as an examinee and practice on what kind of questions they need to be asked. And like you said, there are certain things that are very common, especially in the African setup, right? Whether it's plastic surgery, whether it's orthopedics, whether it's neuro, whatever the field is, infection will be there, trauma will be there. Tumor will be there, malignancy, whether it's benign or malignant tumors, going to be there. Pediatric questions will be there, or pediatric patients are going to be there. So cover your bases and try to see, like you said, what's common in that area, but also some things that are just generally common in across Africa, including late presentations and complications. um, Thank you, Simba. Rahel, so let's come to the Viva part. Um, Tell us what to expect during plastics Viva.
Okay, for the Viva as well, if I remember correctly, there were two stations. So there were many stations, but we are expected to go to two stations. And uh, so what I was asked at that time was on so the same thing that I said, the principles of management of certain conditions. And so they see how you answer, and then if they think that you know very well the topic, they'll try to change to other topics. So they'll try to assess. So different topics may be asked at that time. So I was asked on breast reconstruction, and then I was asked on breast lift. I was also asked on the techniques of abdominoplasty, and so the contraindications for that, and so which patients you choose for that. If this the patient comes with this condition, would you be allowing, like, the psycho status of the patients, all those needs to be considered when doing any aesthetic surgeries. So you don't need to just concentrate on the surgical aspect, but on the other topics also you need to be familiar with.
I love that. So I don't know how it is, but I know in orthopedics we do have, a lot of X-rays, obviously. So most of the Viva revolves around X-rays, whether it's a pediatric case, whether it's an adult trauma, or deformity cases. It really revolves around X-ray. What kind of material should they expect in a plastic surgery Viva?
I think they should prepare like short notes on like when they're asked how they're going to respond depends on how they practiced initially, because you need to be precise, and it needs to be concise, and so you need to have like certain points, but you have to I mean, like, how can I describe it? Like, so you need all the answers, but you need to answer that in a very short, precise way. So the things that you need to prepare is, I don't know if any, keynotes is a very precise book. So you can't have, I mean, read on the Grab and Smith, but keynotes are very short, and so you can go through that. And then on hand surgery, like orthobulate. um, you can because they are concise. Diagnosis, management options, complications, you get that as well. And then if you have prepared already notes while you were studying for the written exam, you should look at that. And then it's better like if you can sit with your friend and ask each other a question, how you're going to respond if that certain question is asked, and then so that the other would say like if you're answering correctly, so you can just comment on one another.
I love that. I think your friends are your best resources at this point. And sometimes I also want to remind people, yes, you might not have other examinees in your specialty from your country, right? Sometimes you're the only one. It does happen. I think at this point there are a large number of trainees that you're usually not by yourself when you go for exams, but you'll never know. So make friends with other people from a different country and practice as long as you are within the same specialty. It will go a long way. That last minute practice with your friend is what's gonna calm your nerve down and really prepare you for what you're going into. So thank you, Rahel, for pointing that out. Simba, you there? Your mic is muted. You can unmute yourself. We can't see your camera, but your mic is muted. So we are now talking about the Viva. I think we lost you for a minute there. We're talking about the Viva part now. So as an examinee, not an examiner, as an examinee, what should they expect in an orthopedics Viva? Simba, if you can hear me, unmute yourself and go ahead. Simba, can you hear me? Okay, I guess until we can get Simba back. Dr. Azarias had joined us for a split of a second and we lost him again. Connection. Come on, Africa. We can do better than this. um, okay. Azzy, can you hear us? Okay, I think he's trying to fix his camera. Um, Simba, you there? Okay. So from orthopedic side of things, on the Viva, you are going to go to different stations, and this is where they're going to get you, right? So most of the cases that you see on the OSCE are not that odd. There are cases that you have seen at some point in your training. Um, even if you don't see a lot of them, you've seen them at some point in your training. So they're not that out of pocket. They're not something you've never seen before in real life. But OSCE is where Viva is where they're gonna get you. You're gonna have all those syndromes and the physical presentation of those syndromes. So all those syndromes that you've studied and may have never seen, those rare syndromes that you've never seen, will be coming up on the Viva. So look at the pictures and practice spot diagnosis. So on x-rays, you obviously have to read x-rays like you always would read x-rays. You remember, since C1, there are sequences to follow when you read x-rays. So don't spend too much time on that, but just like let the examiner know that you know your basics. So just talk about those things. Left, right, it's a x-ray of this body part, the joints are included or not. Is it AP? Is it lateral? Is it both? Do you have both AP and lateral? Um, and just say, from what I can see, it is this. Okay, that's simply for x-ray. And then once you make that spot diagnosis or potential diagnosis, then um, the examiner might say, is there any more information you'd like to know, and so on. So just make yourself think in a very systematic manner, calm yourself down. So no matter how much you know and how prepared you are, if you're nervous and anxious, you're going to miss out on a lot of things. So whatever it is, these people are just your teachers. They're people you know. Okay. So calm yourself down and be very systematic and don't waste too much time. The more questions you get on Viva, it means you're doing good. Okay, so try to get as many questions as possible. The more image you get, you're doing really good. So make sure of that. Make sure you get as many questions as possible in order to increase your chance of getting a better score. Uh, like I said, be calm. Be quick when you see an image to do a spot diagnosis. So all those syndromes and things that you might not commonly see, they're gonna be there on the on your Viva. That's where they're gonna get you. So Simba, we're talking about the Viva part. So as an examinee, what should they expect? You're muted. Simba, you're muted.
Right. Oh, there you go. Sorry. So I say that I probably missed quite a number of issues that you guys were discussing. Um, but I think in a Viva, there's you can get just about anything really in terms of the questions. But the most important thing is just to stay calm, and it is allowed to say, "Can I go to the next question?" Sometimes the questions are hard, so you don't want to waste a lot of time just trying to you know sort of like create an answer that you don't know. So I think where you don't know, you can be honest and say, "Look, I will not be able to answer that question. Can I move on to the next question if there's another question?" And I think most importantly, just to listen to the question and try to speak audibly so you are heard. Sometimes they give you a paper to maybe draw something. I think is don't go into the corner and start scribbling in a corner. Just try to use as much paper space as you can and speak confidently and own your answers. Yeah.
That's a great pointer. I actually forgot about the drawing part. Viva is just the Wild West, to be honest. It's it really depends on the examiner that you get, because some examiners just, yeah, they be doing some extra stuff. Um, so sorry, the neurosurgeon Dr. Azarias is having trouble connecting. Um, anyway, we'll keep waiting on him. So the on the Viva, saying, you raised an excellent point, which is, if you don't know the case, just say I don't know, because the more time you waste on that, it means you're not going to get to be asked more questions. It means you will not redeem yourself. Okay, everybody knows you're not going to know everything about everything. Okay, but if you just waste your time on a case, on a picture that you don't understand, then you're going to miss your chance to demonstrate that you actually have knowledge about other things. Okay, so keep it moving. If you don't know it, just say, I'm sorry, I don't know. I think it might be this, but I don't know. I'm not sure. And end it. Next question. So keep going. Keep the flow. Okay. Thank you, Simba. Uh, Ozzy, can you hear us? Ozzy, can you hear us? Network is bad. You're muted. Can you unmute yourself, Ozzy? Okay, we'll wait. So I'll come back to Simba till then. As an examiner, because I love that you have the opportunity to be on either side of the table. So as an examiner, what would you like to see the examinee do? How would you like to see them answer on when it comes to Viva questions? Unmute yourself, Simba. You're still muted, Simba. Oh, it's me. My bad.
Yeah.
My okay, bad. Go ahead.
Okay, good. Yeah. I forgot to mention that please dress properly. Uh, Try to look good if you can. Put on a tie if you can. You just look presentable. That's the first mark, actually. The moment you walk in, we do tick boxes on how presentable you look, right? And take a seat when you're offered to sit down. You can come in. It's just common courtesy, right? Just good manners. I think that's how I will put it. Just have some manners when you come in. And when you speak, when you're given a chance, and it's usually because we want to make sure you've understood what the requirements are for that station. And then I would like we always like students or examinees who come in with confidence and are able to speak louder. As for most of the examiners are English Anglophone. Let me say Anglophone. We had challenges with Francophone, um, candidates. Now, what happens? The frustration we had as examiners is, a francophone, usually when you are stuck, I would say if I were a francophone, when I'm stuck, I would just keep trying to say, the English is it's evading me, or how do you say this in English? Ask for a translator immediately, right? If you really want to express yourself in French, ask for a translator. In Burundi, they do speak French, so there should be a lot of translators there, but you don't want to give this excuse that maybe the question is not clear because it's in English, because that can be very frustrating, because we will say, why don't you ask, we'll translate the question for you. Yeah. And of course, when you're asked, sometimes in Vivas, we bring a lot of images. Don't assume that there's only one image. There's probably like 4 or 5 other images. How do you know you're doing well? Usually, when you answer correctly on an image, we move to the next image, right? And then on the next image, you now know that, oh, okay, this is the direction of the questions and exam. So you just stay on course, right? Yeah. So mostly, like I said, you need to be confident, and like I said, you really do know these answers, right? There are some stations that are going to be difficult, which are kind of designed for gold medalists, right? So, for those of you who don't know what a gold medalist is, this is going to be the top student in your specialty. So, there are specific stations which are designed for a gold medalist to pass. So it will be difficult, and at the bottom of the marking sheet, I don't know if I should say this, but at the bottom of the marking sheet, it normally says that they say a high level thinking candidate or something like that will answer like this. So when you get to the station, we usually try to run to that question to see if you can answer that question. Trust me, when you answer that question, it means you're going to know that station completely, right? So I don't want you to be disappointed when you get to the station and you feel like, okay, this was a really hard station. Chances are it was for gold medal candidates. And I'm not particular about getting a gold medal. I think if you did very well on your part one, and you are top flying student, maybe gold medal you're going for it. I mean, that's good. What we want you to do is to be a safe surgeon. We want you to handle the patients on day one with minimum assistance, with minimum supervision. We don't want you to be a gold medalist with a student. No, right? So this is just for academic purposes, right? So don't if you're aiming for a gold medal, don't say, oh, it was a bad station, and I think I fumbled. I'm not gonna get gold medal. Trust me, you will graduate at the same time. You might not be recognized separately, but you will graduate. I think um, that's quite important. Um, Also, historically, I don't know who is listening to this, but historically, you need to know like who gets these gold medals, right? I'll tell you that general surgery, the Kenyans have been doing a lot. So, the Kenyans somehow they've hacked it. They normally go for the gold medal. And then previously, the Ethiopians, to be honest, they've been really on top. Not that Anya is my friend, but orthopedics for the past, I think, 3 4 years, it's been going to Ethiopia. Before that, it was Zimbabwe, and where else? But usually it's Kenya, Ethiopia, Zimbabwe. That's just to encourage those guys from those countries that you guys do have quite a number of gold medals. Zambia has a couple, Malawi here and there. I think they also have quite some gold medals. But like I said, the important thing is just to display that you are safe and you will not rush to do a poor management or wrong management on a patient, because sometimes the consequences of your decisions will hurt the patient and you don't want to do any harm. Yeah. So yeah, I can talk a lot on this topic, but I'll give it back to you.
That's good. That's
That's
why we
good.
have
That's
you
what
here to
that's
talk
why
a
we have
lot.
you here to talk a lot.
But I love that you mentioned about how to dress, because I said that earlier. I guess it's an ortho thing as well. Because that was like what I said at first. I was like, you gotta present yourself. You gotta make yourself presentable. Get your hair done, cut your hair, whatever you gotta do. Look clean, be well dressed, and comfortable at the same time. But thank you. Those are really good points, and that's the thing about Viva. The more questions you get, it means you're doing good. Don't panic. Don't be like, oh my God, did I not do good? Is that why they're giving me question after question? If you're not fumbling, if you're doing really good, if you're in the zone and in the flow, you get to be asked more questions. So that's an excellent sign. And like I said, whether it's on OSCE or on Viva, at least in case of orthopedics, um, when you get difficult questions, it means you're doing good. Okay, like Simba said, you know what you're going for when that difficult question comes your way. Okay, so Dr. Rahel has to go. So one last question to Dr. Rahel. What would be your advice? We talked about what to expect in the OSCE, what to expect in the Viva. Um, but what is the one or two things that you want every examinee to keep in mind when they go into their exams?
That they need to be calm, and then just take few seconds before answering any questions, and then be precise, and try to have a flow while answering, and like you need to be louder so that you appear to be more confident. So those things are the ones that I want to mention.
Yeah, excellent points. Thank you, Dr. Rahel. Thank you for spending this time with us.
Thank you.
Hopefully, people who are preparing for the exam will listen to this and will get something valuable out of it. So thank you so much.
You're
Hope to
welcome.
see you soon.
Yeah, sure.
All
Thank
right,
you.
take care.
Bye.
Bye. So Simba, we're gonna keep going. The other thing that I love that you mentioned is where the gold medals have been. And I may be wrong, but I think there's a reason for that. Wherever you have people who have sat for that exam multiple times before that, right, in your department, then they will give you pointers, just like what we're doing now, which is one of the main reasons why we wanted to do this in the first place. I remember for our COSECSA exam, the Cure Hospital Ethiopia had a session for us on pediatric cases. And those people were actually examiners, have been examiners on the COSECSA exam for years, right? So we had the privilege of being trained on what to expect in the exam, specifically for pediatrics, but how you're being questioned is the same, whatever specialty that it is. But we were already familiar with the circumstances. So that has a very important effect. And I think whether it's Kenya or Zambia, you have a lot of people who've sat for the exam before that. So there's this kind of mentorship, this kind of you know advisory thing going on that is guiding people, that is helping them, aim for gold medal and stuff like that. um yeah, so um last, I guess, I don't we talked about a whole bunch of stuff, but you said you can talk a lot about that. So talk a lot about whatever you were going to talk about earlier, because I don't want people to miss out on any important details. Please go ahead.
Go ahead. So I can't talk a lot because I'm purely trained in COSECSA. So starting from first year all the way to my fellowship year, I had a lot of difficulties going into both my membership exam and fellowship exam because for my membership exam there were only two of us from Zambia, if I recall, right? And it was tough getting ready, and we didn't have a lot of exposure to people reading the exam. I mean, they'll be there, they'll try to give you tips, but when we're preparing, we kind of had to do the two of us. And then when I wrote my fellowship exam, I was the only candidate from my country, who was writing the exam. So, we were two of us who were writing the exam. And this brings me back to maybe some tips I would like to give. Um, in Zambia, we sort of figured out how to pass the exam. And I'm not talking about gold medal, I'm talking about passing the exam, right? So what we figured out is this is a talking exam. So you have to do what we call viva practice. Okay. If you are more than one, if even two, three, whatever it is, I think get together. Today is Thursday. Friday, Saturday, Sunday, focus on talking. This is a talking exam. Do viva practice. How we were doing it was we would have different stations, like maybe you're in an Airbnb or whatever hotel, wherever you're starting from, and then just say, okay, look, let's pretend we've got 13 stations, right? Let us say this station is for contractors. Okay, what are they likely to ask on contractors? You can use other material to sort of understand the style of questioning. I think in auto there's quite a number of books. There's one that we were using. So you look at contractures, right? And then just have someone sit across you and then just start asking them questions. So you should be able to give each other, positive criticism, just to say, okay, here you need to talk about this, you time each other. I'm telling you, since we started doing that in Zambia, we've barely had any failures. The ones that were failing were likely coming from, teams that were not doing Viva practice. So I would like to say, if you are already in Burundi and you've been preparing for exams, get together, do Viva practice, learn how to talk, right? It's not every surgeon who likes talking. I mean, that's why you're a surgeon, right? You want your works to your surgical hands to speak for you. You want your outcomes to speak for you, right? You're not exactly good at maybe standing in front of people, and there are other people like Anya here, who can be in front of the camera and confidently talk. You know, I like talking, but that's not really everybody's cup of tea. But because of that, you need to learn how to talk. You understand? So when you're in front of the examiners and you're not talking, that is extremely frustrating. You'll be like, look, you came here to talk. Now, can you talk? Right? And yeah, so number one, please prepare, learn how to talk. If you're on your own, you know what? Close your door, your curtains, and just start talking, right? If you have to record yourself, do it. Just learn your cadence. So cadence is how quickly you're speaking, right? The way you speak. Don't speak too fast. Don't speak too slow. But speak in a confident manner with good cadence and be audible. And you don't have to use big words and sort of like just go straight to answer the questions that you're being asked. Yeah. What else? You find that um, some examiners, especially very well experienced examiners, oh yeah, I need to also outline this. You'll find that examiners are paired, right? So you walk into a room, expect to find, three people, right? I can tell you who these three people are. It's the two are a very experienced examiner and a less experienced examiner. Sometimes it's an examiner from another college, maybe College of Surgeons of Canada or Australia, and then another one will be from maybe Africa. And then so there's always a sort of like a pairing that they do to make sure that it's balanced. Then there's always a third. Usually there's always a third member who is in that examination room. This is someone who's learning to become an examiner. So they're an examiner, but they have to sort of like observe how exams are done. So it's also a grooming process for examiners. So you walk in, don't be sort of like, surprised that there are three people in there and thinking, oh my God, what am I going to do? Sometimes there's a fourth person. And usually these are the invigilators. Sometimes they go around just to see, just monitoring how the sessions are going, right? So you should feel very comfortable. And I want you to know that the exams are balanced, they are fair, and they really are trying to get you to pass, right? Um, and as long as you have been applying yourself, you've been going to OPD to see patients, you're going to the ward, you're going to theater, you're following up on your patients. We are basically asking the same routine. It's just going to say, how do you follow up on this patient? You've got a complication. We can ask you, okay, what are the complications that you would encounter in this surgery, for example? You just think systematically, right? You're going to have those, immediate complications. You're going to have early complications and late complications. You start from there. That is done. That station is done. Now we're going to say, oh, so early, immediate complications. What are they? Then start talking about it. It's not like we ask you what are the complications and you just jumble them up together. So the examiner's been trying to see, okay, we want to help you. We want to look. What have you mentioned? But if you answer it in a systematic way, it's easier for the examiners to really give you a good score and for you to pass. Yeah.
100%, 100%
100%,
agreed.
100% agreed.
It's just, when you think systematically, you tend not to miss things, right? So that's just, is it systematic? And you start thinking systematic when when you do something repeatedly. So it just goes to show the examiner that you are really prepared and you know what you're talking about. So I love how you mentioned that. When you say immediate, early, late, the examiner is already satisfied. It's not even on what the details that come after. It's the fact that, okay, this person has already a systematic approach to the case, so they're a safe surgeon, like you just mentioned. So that's very important. I love that you mentioned that. Ozzy, can you hear me?
Yeah, sorry, Annie. I had an emergency I had to attend to. I can
No
hear you.
problem. No problem. Thank you for joining us. So Dr. Azarias is a neurosurgeon. He is, he's a FCS, a member of the College of Surgeons of COSECSA, and also he's an associate professor of neurosurgery. he's been an examiner on COSECSA exams as well. So I love this because we had a plastic surgeon give us a little bit of an insight. We have an ortho surgeon, and now we have a neurosurgeon. So Azi, welcome and thank you for doing this. So the first question is, I want you to give us pointers as an examinee. What should an examinee expect when they walk into the exam? Um, for You can start with the OSCE and then go to Viva. It could be something general, it could be something very specific that you remember, but what are the things that they need to uh, be preparing with, last minute?
Okay, so it has been a while since I attended, but from what I gather from exams, I've been examining residents for more than 10 years now. So just know that everybody is rooting for you. Everybody wants you to pass. We just want to see that you know what you're talking about. And on OSCE exam, what you should expect is, common cases. Don't don't study that random rare case that you see on the book. For example, if it's a neuro exam, just focus on the common things like hydrocephalus or common tumors, be it an adult brain tumor or a pediatric tumor. If you're talking about the spine, just focus on trauma and things that you commonly see. And if you think about infections, just think of TB or some sort of pyogenic infections. Don't think of complicated diagnosis and those rare cases. Just focus on the common ones. Just know that everybody's rooting for you, and people are there just to direct you to the right way. So try to think in that way. And if you don't understand things, just ask clarifying questions to make things clear. Don't just go on saying what you're thinking. Try to understand what the examiner is asking you, right? So these are the things you have to focus on, Oski, and you have to be precise. And if you're not clear, if you don't know it, just tell them you don't know it. It's fine, because Oskis have a bunch of stations, and it's okay if you don't answer one question in one station. You can compensate, and everybody's gonna get the same question. So just relax. It's gonna be okay. You've been doing this for the past couple of years, so you got this, right? So this is what you should focus on. OSCE OSCE part of the exam. So when we go to the Viva, as my friend from Zambia was saying, try to talk. Yeah. If you don't talk, we don't know if you know, right? The only way we know that you know is if you tell us something related to the case. And always try to, as I said, ask questions to make what they're asking you is clear. And then after that, think for a few seconds. Take like 10, 15 seconds just to think. And as you were saying, you need to be systematic. You need to have that framework, because you've been doing this since medical school. Whenever somebody asks you something, just when you get the whatever, the be it the image or the chief complaint or whatever you get, just think of your differential diagnosis, think of the most likely and then the least likely, and then think for a few seconds and then answer in that way. Just have some framework. You know how to approach this. It's not new. You're not going to invent some new way of approaching stuff. You just practice what you've been doing for years since medical school. So have that framework, list your differential diagnosis, and be systematic. And whenever they ask you about surgery, start from the basic, like counseling the patient, getting informed consent. People would know what you're talking about. We're not butchers. So we're dealing with people. So make sure that you know that. Just think how you would approach the patient, because you know this residency is, the beautiful thing about practicing medicine is you do it every day. So don't think that you have to create something new. It's just what you've been doing for years. So just talk what you know and be systematic, have that framework, and then approach it. Yeah. And all the surgeries people talk about are going to be common procedures. As I've said earlier, we deal about we deal on these common cases, and then complications are also going to be, and surgeries are also going to be on those common cases. So whenever you are asked about um, complications, or what to expect post-op, you can, as you said earlier, you can do like early, late, immediate, early, late, or you can do like system specific and general complications. All the general complications. First post-op day, third post-op day, fifth post-op day, first week, second week. These are common things you see in all these surgeries. So just put those in the back of your mind, and then say that you have general complications, you have specific complications, and these are common procedures. So don't rush, think, focus, and speak what you know. It's that simple. I know you're going to be anxious. It's normal to be anxious, but if you take a few seconds, you'll have time to organize yourself, because you know it, and you're not going to miss things. And then during Viva, just give the examiners the chance to ask what they want to ask, because sometimes examiners would have a specific thing they want you to say. So unless you give them the chance to communicate with you, you won't answer those questions. So that might result in some deduction in your marks. So be systematic, speak what you know. If you're not clear, ask questions, and give yourself some time to think. You don't need to rush, and then give the examiner a chance to ask what they're really asking about, and then specific things they want to know. These are these are
When you
basic things. Yeah.
say ask questions, what kind of questions? Because as an examinee, it would be nerve wracking to sit there and ask questions. So what kind of questions should the examinee ask? Like more information about the image, especially on Viva, it's usually some sort of images in front of the examinee. So you mean like asking more question about the image, or what kind of questions would help?
So, for example, you see an image and you list your differential diagnosis, and then maybe the examiner is looking for a specific complication. So, if they're just pushing you to, add more differential diagnosis, you can ask, like, can this be congenital? Like, what they're looking for. You can say like congenital, infectious, because if you're systematic, you list your differential diagnosis like congenital, inflammatory, metabolic, vascular, infectious, trauma, inflammatory. You have this list, and then you pick from this list, and then maybe the examiner has a specific thing you want to mention. They want you to mention, so you can, if you have, some suspicion, you can just say, "Can this be an infection or something?" And then that would just nudge you in the right direction. That's what I meant. So being systematic is extremely important. Just have that framework. When you approach anything, just have those basic things you follow. Have those basic things you follow. So that's very important in every every aspect of the exam. Even in OSCE, you have to be systematic. Uh, be it a patient to examine, be it an image to see and comment on. be it type of surgery you need to explain, all those things, just have a specific kind of approach, and that's really helpful. Not only in this exam, actually. When you practice as a surgeon, you need to have a specific steps you need to follow in each type of surgery. So if you do those things, life would be easy in general.
100% agreed. Thank you for all those good pointers. I think it's very important. I mean, being systematic, obviously. And we were talking earlier. I don't know if you were able to hear what you were saying, but we were talking about practicing with as our examinees on how to approach things systematically. Like interview each other, learn how to answer and think in that way. But also, as an examinee, you if you preparation is just the only way you can also avoid being anxious, right? If you feel prepared, then you won't be as anxious. So just prepare, prepare, prepare. Pair up with people. If you don't have any examinees from your own country, find somebody else from a different country within the same specialty and practice with them. It goes a long way. And Simba also mentioned that sometimes if you are a francophone, you don't, you're a French speaking country, then ask for an interpreter while you take your exam, because sometimes a lot of things may be lost in translation and you might not be able to explain yourself as you could in English versus in your mother tongue language. So he mentioned that, and I appreciate that. Examiners actually, they're very friendly. They smile. They make examinees very comfortable. So that's also another thing. It's really good. So, as from neurosurgery perspective, Azi, what things, as an examiner, what things do you not want your examinee to miss? Let's start with Oski on history and physical examination. What are things that they just cannot miss? Like if they miss those things, it's it's a bad signal for the examiner, and you may be discouraged to ask more questions because it's just so basic, and this is something you just cannot miss. Are there any points like that you would like your examinees to focus on?
Oh, yes. So the commonest symptoms, signs, imaging findings, and treatment modalities are the commonest diseases you see in neurosurgery. So everybody knows these. They're supposed to know these. So if you don't know these, it's a problem. You're gonna fail. But nobody's gonna blame you if you don't know how to approach some fancy skull base tumor with one of those triangles. There are multiple triangles in the skull base, the middle fossa, and things like that. So if you don't know those specific fancy approaches to do those surgeries, nobody's going to blame you. But the commonest things you need to know. And in Africa, you need to know those things related to infection, like TB. TB anywhere, you need to know. Anywhere, might be in the brain and the spine, you have to know about TB. And then hydrocephalus, you need to know. Neural tube defects, you have to know. These things are extremely common. And some infections, like hydatid cysts and things like that, you need to know. So, common things are expected from you. Common disease presentation and physical examination you need to do, and then imaging findings and how you approach surgically. These are important, and you have to know all things related to the surgery, including complications and things like that, and how you can manage complications. So I'm not sure if If other countries also include spine in neuro, but we also do a lot of spine. So half of our practice is spine. So you need to know also common things about spine. As I said earlier, like trauma, trauma is also extremely common, be it uh, traumatic brain injury or spine injury is extremely common. So you have to know the in and outs, and then you have to know the treatment, including spine injury. And these are, common things. But I'm not gonna expect you to tell me the details of, for example, these approach to the craniocervical junction and specific things you need to do, where you're gonna put your screws and stuff like that, like which one is superior, which one is a superior technique, and why, and stuff like that. Nobody's gonna expect you to answer all those questions. I mean, if you're really good at this about answering the questions, we might reach to that point. But if you don't know those things, it's not a deal breaker. So yeah, these are the things you need to know to pass.
Yeah, great points. Rahel earlier mentioned ATLS. So when it comes to trauma, it doesn't matter which specialty you're in. Whatever it is, if you're talking about trauma, always start with ATLS. Always, just that just goes
Yeah,
across
yeah.
all specialties. Um, okay, how about Viva, Ozzy? Specifically neurosurgery Viva. uh, how can examiners know that they're doing good? What telltale signs are there from the examiner's side to let them know that they're doing really good? And if they don't know an answer, what would be the best thing that they can do in that situation?
Just tell the truth. If you don't know something, tell them you don't know. Because you'll have a chance to have another question, another image that you might know, and then you would show them that you know. Otherwise, if you just, keep on talking nonsense and then, that's it, they would think you're a fraud, right? So you do not want that. So they will tell you if you're doing okay. They'll tell you you're doing okay, and then they'll tell you specific things if they want to know something specifically. They will tell you, yeah, tell us this thing in in detail and things like that, so that they'll give you a chance. As you said, they're friendly. They want you to answer. So just read their cues. It's not they're like examiners are not like this enigma you have to decipher. They're people like you. They want you to do good. So just relax and then read their body language, and then they'll tell you if you're doing okay.
That's great. So how do you go for the gold medal in neurosurgery? What would be if someone, we all have different goals. Some people just want to pass, some people want to go for the gold medal. So how should the person who's going for the gold medal prepare? And uh also, which exam is very I mean, value wise, obviously, I think these things are given in detail when we go for the exam. They give us this paper about how much each part of the exam weighs. So where should they focus more if they want to do great, score high, maybe aim for a gold medal in neurosurgery?
Well, I have no idea. I mean, I got the medal when I took the exam, but I cannot tell you specifically do this or that, because if you have been doing very well for the years of residency, you'll get the medal. I mean, it's uh it's luck, I guess, but the luck comes when you're ready. Luck is when opportunity meets preparation. So you're not gonna get the gold because you're ready for the past few days. You have to get ready for the past 4 or 5 years or 6 years. You were doing residency. You have to get ready. If you're ready, There is a high chance that you're going to get the medal, but it's really not going to change anything if you get the medal or not. Just make sure that you're going to be a good a, you're going to be what do you call it, a surgeon that's going to do the best for your patient. Just know your limits. That's the most important thing. Instead of getting the medal, just focus on being doing the best you can for your patient, and then knowing your limits, and then act accordingly. Just remember first the first thing is do no harm. So always put that in your mind. Don't see patients as challenges. Don't see them as difficulties to overcome, or to show that you are a courageous and heroic surgeon. That's very dangerous. Just know your limits. Do the best for your patients. I mean, you can learn it the hard way, or you can just learn it from me. It depends on how you have been dealing with life, or you're gonna learn. But that's the most important thing, instead of going for the medal or whatever.
Gotcha. So I don't want to hold you because you were just in theater. What I don't know if you remember because it's been a while since you took the exam, but what materials should they use this, last minute couple of days before the exam? What materials do you think would benefit them from reading?
Materials to read. Well, neuro is basically so for this short period, I would focus on Greenberg. There's a there's a handbook of neurosurgery called Greenberg, so it's a concise and quote unquote, it's not a small book, but if you have to go through some reading, you need to do that. Just focus on Greenberg. All the other texts are too big to deal with at this point, because Greenberg has everything. It just gives you a short list of, as an introduction, like we'll have a table, and we'll just put things in that table, common things about that specific disease, and then all the surgeries are grouped in one chapter, and then all surgeries will have the steps you need to follow, and the complications, and how to treat complications, stuff like that. So just focus on Greenberg, and there is an index on Greenberg that would there are like a bunch of tables, and these scoring systems, like the Asia grading for spine injury, and the Glasgow Coma score, and the Hemphill score for ICH, and things like that. Common scoring systems that you need to know in neurosurgery are there. So just focus on Greenberg.
Great. Thank you, Ozzy. Appreciate the good
You're welcome.
pointers. Um, Anything else other than preparation? Anything we've missed? Anything you think should be mentioned that examinees should keep in mind before I let you go?
So I'm not sure if you talked about this, but you, you might direct examiners in uh, in a direction that you don't want them to go. So
Yes, tell us
just
more.
yeah, just if you don't know the exact answer of what they're asking you, you can guide them to the things you would know about that stuff. For example, if you don't know about, for, let's say, scoring system of the thoracolumbar injury, for example, if you don't know the AO system of scoring, don't go into the AO system of scoring. Just go to the whatever be it Tilix or the older systems. Just guide them in that direction. not in the direction that you don't know about. So, because you would create questions in the examiner's head, and then you would end up losing points. So, if you're not clear, just make sure they clarify what they're asking. And if you still don't know, just say, I do not know. Otherwise, there's always a room to wiggle, you know? When they ask you something, you can always push them in the you want. But you have to be systematic and smart. Even when you, for example, for the OSCE, if you have a patient and you have to do some cranial nerve examination, for example, if you don't have a tuning fork, nobody's going to ask you about Rene and Weber and stuff like that. But if you have a tuning fork, they're going to ask you, and then you have to be ready. You brought all those questions upon yourself. So you are responsible if you lose, you know?
Yeah.
Whatever you're going to take to the exam, whatever you're going to speak about, or whatever uh, tool you're going to use, make sure you know how to use it and you know the in and outs before, you know, engaging and talking about it. Because the examiners always know more and they can take you in any direction. So you can you can you can take them in a direction that you're comfortable with, you know details about.
Yeah, 100% agreed. I could not emphasize that more. You're right. Like, just don't blab. Just stop. Talk about only stuff you are 100% sure that if they ask you in depth, you're able to answer. If not, just just say I don't know. Just say I don't know. That's it, and then focus on the stuff that you've already read and is prepared for. Yeah, okay, thank you so much, Azi. Thank you for coming on. Great pointers. I think it's gonna help a lot of people. Appreciate you. I'll let you go.
You're welcome. Sorry for the delay I caused. This
You're
is
good.
the life of a surgeon, so
Understandably. All right, Azi, have a enjoy the rest of your day.
thank you. Take care.
Bye.
Good luck, guys.
Thank you. All right, Simba, I'm back. We're back. Um so last words, it could be may God be with you. No, I'm kidding. What materials do you suggest that they read in this last days of preparation? Because it can be very overwhelming. You know, they have to learn about how to take the exam just because of the type of exam, but also they also have to, you know, revise and, you know, go through some reading materials. So what reading materials would you suggest that they use? Unmute. I still can't hear you for whatever reason, Simba. No, it's not. It's not on my side either.
Okay, how about now? Okay, good. Yeah, so I was saying at this point, I'm confident people have got the right resources. I would suggest that you narrow down to maybe one particular exam preparation book. There is the FRCS Viva uh, textbook. It's got a strange names, Z, and it looks Greek. I don't know what it is, but I'm sure people have that. It's just good for Viva practice. And I would stay away from trying to learn something new. I like what Azi was saying that this is what you've been doing from medical school. So you're not gonna expect anything crazy. But if you've been attending your rounds, your clinics, theaters, and you probably are in the right space to write this exam. Yeah, and just want to say good luck to everybody. We definitely need a lot of surgeons here in Africa. There's a huge shortage, and the exam is just meant to standardize how we're going to take care of our people. whether you will be working in your country or you move within the COSECSA region. But the important thing is that we are, treating our people correctly. So, guys, we would like you to come and join us and to close the deficit that we have. And I think that, if you are tuned into this program, it means you want to pass. And I think you will pass. Yeah.
Yeah, thank you so much,
Yeah, thank
Simba.
you
I
so much,
appreciate you
Simba. I appreciate you.
making time to join, despite the fact that I can see you're still in your scrubs and coming out of surgery. Okay, that's good.
Okay.
All right. Thank you. Thank you so much. Y'all just watch this video again and again. It has all been said. We've had examiners, we've had examinees. You've had the access and insights from people who have done this before, and it's extremely valuable. Just calm yourself down. It's okay. You've done this many times, many times before. There's nothing new. Um, and yeah, just focus on doing good and passing the exam. If you go for the gold medal, then more power to you. We congratulate you on that. And you've heard it from the gold medalist himself. You don't even know how you're getting that gold medal, but it just means you're doing good. And like has been mentioned, if you've been doing great, then you definitely do really well on the exam as well. So good luck to everyone. And this is not just for the exam in 2025. Unless anything is going to change in the next few years, we're going to have more guests to come and talk about new changes and updates, so that you can always come back to this video and watch, whether it's on YouTube or LinkedIn. Uh, Subscribe and follow our YouTube channel, the Everyday Leader podcast with Dr. Ananya, or follow my LinkedIn, Ananya Kasahun Admasu on LinkedIn. You can find me. All right. Good luck.